Hi everyone, welcome to our channel, where we share useful tips and information on various topics. In today's video, we will discuss how poor oral hygiene affects your whole body. You might think that oral hygiene is just about having a nice smile and fresh breath, but it is much more. Poor oral hygiene can lead to gum disease, tooth decay, and bad breath, but it can also increase your risk of serious health problems such as heart disease, diabetes, respiratory infections, and cancer. How does this happen? And what can you do to prevent it? Stay tuned and find out. Poor oral hygiene can cause microbes from the mouth to enter the bloodstream, triggering inflammation and infection in different body parts. Here are some of the complications that can result from poor oral hygiene. Cardiovascular disease. Gum disease can damage the blood vessels and increase the risk of heart disease, stroke, and clogged arteries. This is because gum disease can cause bacteria from the mouth to enter the bloodstream and trigger an immune response. This can lead to inflammation and damage in the blood vessels, increasing the risk of blood clots and plaque buildup. According to a study, people with gum disease have a 25% higher risk of heart disease than people with healthy gums. Endocarditis. Bacteria from the mouth can also infect the lining of the heart valves, called the endocardium. This can cause inflammation and damage to the heart tissue, resulting in a condition called endocarditis. Endocarditis can affect the heart's normal function and cause serious complications such as heart failure, stroke, or death. People with poor oral hygiene are more likely to have dental plaque and bacteria that can cause endocarditis. Diabetes. Gum disease can make it harder to control blood sugar levels and increase the risk of diabetes complications. This is because gum disease can affect the body's ability to use insulin, a hormone that regulates glucose metabolism. Gum disease can also increase the levels of inflammatory molecules in the blood, impairing glucose tolerance and insulin sensitivity. A study found that people with severe gum disease have a 3 times higher risk of developing type 2 diabetes than people with healthy gums. Respiratory infections. Bacteria from the mouth can travel to the lungs and cause pneumonia, bronchitis, or other respiratory problems. This is especially common in people with poor oral hygiene who have a lot of dental plaque and tartar that can harbor harmful microbes. These microbes can be aspirated into the lower respiratory tract and cause inflammation and infection. A study found that people with gum disease have a 4.5 times higher risk of developing chronic obstructive pulmonary disease than people with healthy gums. Pregnancy and birth complications. Gum disease can increase the risk of preterm birth, low birth weight, and preeclampsia. This is because gum disease can trigger the release of inflammatory substances called prostaglandins, which can induce uterine contractions and labor. Gum disease can also affect the placenta, which is the organ that nourishes and protects the fetus. Gum disease can cause inflammation and infection in the placenta, reducing blood flow and oxygen delivery to the fetus. A study found that pregnant women with gum disease have a 7 times higher risk of delivering preterm low birth weight infants than pregnant women with healthy gums. Osteoporosis. Bone loss in the jaw can be a sign of osteoporosis, a condition that weakens the bones and increases the risk of fractures. Osteoporosis can affect both the quantity and quality of bone tissue, making it more fragile and prone to breakage. Osteoporosis can also affect the attachment of teeth to the jaw bone, causing tooth loss and mobility. A study found that postmenopausal women with osteoporosis have a 3 times higher risk of tooth loss than postmenopausal women without osteoporosis. Rheumatoid arthritis. Gum disease can trigger joint inflammation and worsen rheumatoid arthritis symptoms. Rheumatoid arthritis is an autoimmune disorder that causes chronic inflammation and pain in the joints. Gum disease can stimulate the production of antibodies that attack both the gum tissue and the joint tissue, causing more damage and inflammation. Gum disease can also increase the levels of cytokines, which are inflammatory molecules that aggravate rheumatoid arthritis. A study found that people with rheumatoid arthritis have an 8 times higher risk of developing gum disease than people without rheumatoid arthritis. Cancer. Poor oral hygiene can increase the risk of oral, throat, pancreatic, esophageal, and lung cancer. This is because poor oral hygiene can cause chronic inflammation, DNA damage, and immune suppression, which can promote cancer development and progression. Poor oral hygiene can also expose the mouth to carcinogens such as tobacco, alcohol, and betel nut, increasing the risk of oral cancer. A study found that people with poor oral hygiene have a 75% higher risk of developing oral cancer than people with good oral hygiene. In conclusion, poor oral hygiene can seriously affect your overall health and well-being. It can increase your risk of various diseases and complications affecting your heart, lungs, bones, joints, and even your life. Therefore, it is important to maintain good oral hygiene habits such as brushing your teeth twice a day, flossing daily, using mouthwash, visiting your dentist regularly, and avoiding tobacco and alcohol. By taking care of your oral health, you can also care for your whole body and prevent many health problems. Thank you for watching this video, and we hope you learned something new today. If you liked this video, please give it a thumbs up and share it with your friends and family. Also, don't forget to subscribe to our channel for more informative videos like this. And if you have any questions or comments, please leave them below and we will try to answer them as soon as possible. See you next time and stay healthy.